let's start from the beginning. As we can see from the map right here, the epicenter of the spread of the virus has been Wuhan. From the center of the China in December 2019, this anomalous pneumonia reaches Italy and then is identified as a new virus, the SarsCov-2, which stands for Severe Acute Respiratory Syndrome, or COVID-19, as we all know.
Coronavirus is zoonotic, which means that the virus is transmitted between animals and humans. SarsCov-2 is the responsible pathogen of this current pandemic influence. Actually, SarsCov was transmitted from civet cats to humans. So, before talking about disease, what is coronavirus? Coronavirus is part of a virus family and it causes sickness, respiratory disease, or gastrointestinal disease. Coronavirus got its name from its shape under a microscope, and the virus is surrounded by an envelope with spikes protein. This gives it the shape of a crown, an ancient Latin word. Virus is like a microscopic parasite, generally much smaller than bacteria. It hasn't the capacity to reproduce outside of a host body or a host cell, so virus is the cause of contagion. It's possible to classify a virus according to its nucleic acid type, its shape, its presence of the envelope, and its dimension. Here we can see that morphology is very important to classify the different types of virus. Now let's give a look to the coronavirus morphology. Inside the capsid there are the genome and the RNA. Outside the capsid it's easy to recognize the membrane around it, and then the virus surface, the envelope, with receptors and spike proteins that help the virus attack and infect human cells. It's an enveloped virus based on RNA genome. There are different types of proteins on membrane and envelope, such as spikes. These spikes can spread through droplets, and the first step of the contagion is when the virus attacks cell membranes. So the virus attacks through receptors of cells with their proteins. When the virus attacks through receptors, there is the fusion of the two membranes. In this way, the genome is released inside the host cell. Once inside the cell, it recognizes the RNA as its own RNA, and this RNA can follow two pathways. One is the transcription thanks to an enzyme called RNA polymerase, and the second is the translation in proteins and enzyme necessary for the assembly of new virus. The last stage is the release of the virus out of the cell that happens with budding, without killing the cell. So now the virus is ready to infect the other cells, that are neighbor cells. Here we can see the different type of common symptoms. We have fever, fatigue, a dry cough, loss of smell, loss of appetite, body aches, shortness of breath, and mucus or phlegm. The virus can also spread person to person through respiratory droplets produced when an infected person coughs or sneezes. It's also possible for the virus to remain on a surface or object and be transferred by touching and entering the body through the mouth, nose, or eyes. To prevent coronavirus contagion and disease are important these habits. Wear medical mask, wash your hands, cover coughs and sneeze, avoid touching face, and go to the doctor.
Regarding the trends in Italy at the moment, the number of infected is about 500,000. The number of deaths is about 100,000, and the number of ill is about 3 million. Let's move to the next graph about the new infected trend. As we can see, from March to May, the number of infected people is rising, but only since September we have seen the highest number of confirmed cases. The spread of coronavirus in Italy has hit every age group uniformly. As the chart shows, however, mortality rate appeared to be much higher for the elderly patient, 19.5% for people between 80 and 89 years of age. For those older than 90 years, increased to 24.3%, but on the other hand, the death rate for individuals under 60s was well below 1.7%. Overall, the mortality rate in Italy reached 3% higher than that registered in most countries. Multiple COVID-19 variants are circulating globally. Basically, when a virus replicates or makes copies of itself, it changes. These changes are called mutations. A virus with one or more new mutations is referred to as a variant of the original virus, in this case of SarsCov-2. In the fall of 2020, several new variants emerged, most notably the UK variant, the South African variant, and the Brazilian variant. Here we have a picture of an antibody. Antibodies, also called immunoglobulins, are proteins produced and secreted by B lymphocytes. They bind to foreign substances that invade the body, such as bacteria, viruses, and pollen. A vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. There are several different types of vaccines: mRNA or RNA vaccine, the activated vaccine, non-replicating viral vector vaccine, and protein subunit vaccine. The American companies Pfizer, BioNTech, and Matera vaccines use mRNA technology, a type of vaccine that uses a copy of a natural chemical called messenger RNA or mRNA to produce an immune response. Let's check the dashboard about the total vaccines distribution in Italy. The amount of vaccines administered in Italy at the moment is about 25 million. Per types, we have 15 million for Pfizer-BioNTech, followed by AstraZeneca, 6 million. We have Matera, about 2 million, and in the end, 300,000 for Johnson. Here there are some treatment options to cure COVID-19. Antivirals are a class of medications used for treating viral infections. Anticoagulants are drugs that treat blood clots and help prevent blood clots formation in the veins and arteries. Immunomodulators are substances that work to calm your immune system over an extended period of time. And in the end, immunologic agents are drugs that can modify the immune system's response either by enhancing or suppressing the immune system. Another option can be monoclonal antibodies, which are laboratory-made proteins that mimic the immune system's ability to fight off harmful pathogens such as viruses. According to scientists, returning to normal after pandemic is a long way off, even after vaccination, because we have to continue to take security measures, especially for people at high risk, like wearing a mask and avoiding crowded places.